In this ortho-K case, we've got a patient where lens wear is inducing a little bit of what the rule of astigmatism. Patient has about 3/4 of a diopter of SIL prior to treatment, and after treatment with the lenses off, we're measuring about 1 1/4. So something about the way the lens is positioned or the way it's fitting is inducing some SIL, and let's try to take care of that. So what I'm looking at is pre and post topographies. Looks like the lens is decentering a little bit towards the ear, and that can cause the symptoms that where the patient is reporting. So to get this lens to center a little bit for side-to-side decentration, usually what we want to do is increase lens diameter. So we measure the HVID pretty generously. We're about 11.5, between 11.5 and 11.6. So for this patient, I would go a little bit bigger, maybe to an 11.3 or even 11.4 overall diameter. And I would also, let me bring up the lens here. So here we have the two lenses the patient has worn. Pretty similar lenses, except the second one just has a little bit more topo demand. So starting from the lens that the patient has now, we go all the way to an 11.4. And then we also need to readjust this. Wave will automatically shift our OZ and IC control points. So let's bring this back down to the 6.3 that you had before. We don't have to change the vertical position, and then this one is at 6.9. Alright, so a slightly larger lens, the same OZ-IC placement. The other thing I would do is turn the blending back on. I'm not exactly sure why, but I have seen with quite a few of my own cases that having the blending off kind of affects the stability or centration of the lens. So I do like to leave the blending on for just about all of my patients now. It helps to keep that lens a little bit better centered. We want to reset our center thickness. And I think that's probably all I would change for this lens. We're getting pretty good peripheral alignment. We don't want to go too tight. So I don't think we need to increase bearing peripherally very much. I would dispense this lens to the patient, follow up in a week, and hopefully we'll see a slightly better center treatment zone and slightly better vision as well. So best of luck with your patient. Hope the video helps, and thanks for watching.